Today we are going to do a review of the pharmacology of alcohols using what I call as a review map. These are the various topics that we're going to discuss. We'll start off with the mechanism of action of alcohol. Now, alcohol is a CNS depressant and it's able to cause CNS depression by both the mechanisms. It increases GABA transmission. GABA is an inhibitory neurotransmitter, and it also decreases glutamate transmission. Glutamate is an excitatory neurotransmitter. So therefore, both of them contribute to the CNS depressant action of alcohol. Now, because alcohol is a CNS depressant, we need to be very careful when we are dosing it with other drugs which can also cause CNS depression. The common ones to be aware of are benzodiazepines and barbiturates, but there could be other CNS depressants like antihistamines or antimuscarinic drugs that could cause additive or synergistic CNS depression with alcohol. There are some pharmacokinetic parameters of alcohol that we need to keep in mind. The volume of distribution of alcohol roughly corresponds to the total body water, which is about 42 liters in a 70 kilogram person, adult. So it kind of equilibrates where water equilibrates. Fats generally delay the absorption through the GI route, and it predominantly gets metabolized through the liver. So liver contributes to about 90% of metabolism, where the other 10% gets metabolized in extra hepatic tissues. In the liver, the major pathway that is responsible for alcohol metabolism is the alcohol dehydrogenase pathway, and a minor pathway is the microsomal ethanol oxidizing system. Alcohols gets metabolized to aldehyde, and aldehyde gets metabolized to the corresponding acid, and the first reaction is catalyzed by alcohol dehydrogenase, and the second reaction is catalyzed by aldehyde dehydrogenase. With each reaction, a NAD plus gets converted to NADH. This results in depletion of NAD, and there is too much amount of NADH that gets accumulated within the cells. Ethanol is the most common alcohol that is abused, and ethanol gets converted to acetaldehyde by alcohol dehydrogenase. Acetaldehyde gets converted to acetic acid by aldehyde dehydrogenase. Alcohol follows zero-order kinetics, which means that as we keep increasing the dose of alcohol, its concentration tends to increase exponentially, and the clearance could decrease and the half-life could increase. You need to be careful at higher levels of alcohol. It gets eliminated through the lungs, and that's exactly why alcohol is measured in breath analyzer, which could correlate to what is present in the blood. Now, we saw that the alcohol dehydrogenase pathway, there are a lot of NADH that gets produced and NAD depletion occurs. Now, this relates to a lot of metabolic side effects that's seen with alcohol, both acutely as well as in the chronic setting. Lactic acidosis happens because of the inavailability of the NAD to help in the metabolism of glucose. So most glucose will have to, the pyruvate gets converted to lactic acid, and lactic acid starts accumulating. Hypoglycemia occurs again, that is because of decreased hepatic glucose output, and the fatty acid storage in the liver also increases. That causes fatty acid steatosis. That's the mechanism for fatty liver seen in alcohol. Now we'll go on to the acute intoxication. Acute intoxication often presents with severe CNS depression, and most of it could result in aspiration. Aspiration happens because of loss of protective reflexes, which result in food getting into the trachea or secretions getting into the trachea and cause aspiration. Hypotension again because of CNS depression, which also depresses the sympathetic nervous system. Hypoglycemia because the hepatic glucose output is decreased. Metabolic acidosis partly contributed through the lactic acidosis, and also other metabolites which are acidic in nature starts accumulating. And Wernicke-Korsakoff syndrome, which happens due to thiamine deficiency, which are more common in alcoholics, can also be seen in these patients. The treatment is often supportive. We basically see what's wrong and we try to correct it and wait for alcohol to get eliminated from the body. To treat hypoglycemia, it should be noted to always give thiamine along with glucose, because glucose alone could result in central pontine myelolysis. And electrolyte imbalances are very common. We need to be careful and treat them. Chronic symptoms, there could be multiple symptoms. Here I've listed some of the important ones. Dilated cardiomyopathy is often seen with alcoholics in the long term. Gout is common in alcoholics as well. GI ulceration, liver cirrhosis, pancreatitis, both acute and chronic, peripheral neuropathy, and muscle wasting are seen in alcoholics. Muscle wasting because nutritional deficiencies are very common. In advanced stages, patients could become cachexic and they could have protein energy malnutrition. Now, there are other alcohols. The common alcohol that is used is ethanol, but there could be other alcohols which could also be poisoned. Two important ones that we need to know are methanol and ethylene glycol. Methanol gets converted to formaldehyde, and formaldehyde gets converted to formic acid, while ethylene glycol gets converted to glycoldehyde and glycolic acid, and finally into oxalic acid. In the metabolism of ethanol, we have aldehyde and acid that is getting produced. In methanol, we have formaldehyde and formic acid. Formic acid is toxic to the retina as well as the retinal nerves, so patients could end up with blindness if too much amount of formic acid accumulates. Ethylene glycol, one of the metabolites that accumulates, is oxalic acid that can result in nephrotoxicity. And both methanol and ethylene glycol can cause respiratory failure and high anion gap metabolic acidosis. To treat these, we try fomepizole, which is an alcohol dehydrogenase inhibitor, which tries to reduce the metabolites from accumulating, therefore reducing blindness and nephrotoxicity in these poisonings. And we can also try ethanol, where ethanol tries to act like a competitive inhibitor by getting metabolized by the alcohol dehydrogenase and prevents methanol or ethylene glycol from getting acted on by the enzyme. Finally, how do we treat a person who has alcohol dependence? Now, physical dependence often presents with withdrawal symptoms, and the symptoms are important to notice because some of the symptoms could lead on to life-threatening conditions. The earliest symptom of alcohol withdrawal is insomnia, anxiety, and tremor. Within the first 3 days, patients can experience withdrawal seizures or even hallucinations. Between 3 to 9 days, patients can experience a very severe form of sympathetic overactivity called as delirium tremens, where patients could have extreme tachycardia, anxiety attacks, tremors, and even arrhythmias. It's important to note this and treat accordingly. The treatment principle of withdrawal symptoms are going to be using a substance which has similar mechanism of action but is long acting. So we use benzodiazepines because benzodiazepines also activate the GABA system. The benzodiazepine that can be used is either diazepam or lorazepam. We use diazepam if there is no evidence of liver damage, but if there is liver damage, diazepam could get accumulating, and we use lorazepam instead. Clotridine can also be tried. It's an alpha-2 agonist which causes sympatholysis, because I just said that delirium tremens, there is sympathetic overactivity, so some of it can be controlled by giving sympatholytic drugs as well. For a person who's addicted, we can give de-addiction therapies. The common one that is used are disulfiram, acamprostate, and naltrexone. Disulfiram is now commonly used because it tends to be more of a aggressive therapy. Disulfiram results in blockade of the aldehyde dehydrogenase. It results in accumulation of aldehyde, which causes the aldehyde syndrome, where you have vomiting, nausea, and hypertension. Now, this could be serious if patient consumes too much amount of alcohol. It's usually given for those well-motivated patients who want to, cut down alcohol. Taking a little bit of alcohol causes, all these unpleasant side effects that results in patients slowly associating alcohol with the unnecessary effects rather than the euphoric effects of alcohol. Acamprostate and naltrexone are also found to reduce the relapse rates in patients who are trying to have de-addiction therapy. I hope you found this review using my review map very helpful. I'm planning to do such reviews for all topics in medicine, so if you're preparing for USMLE or other board exams, kindly like and subscribe to my channel, and you can see more videos coming up soon. Thank you.